Seniors, please listen closely. I am honestly shocked to share this with you today. There is a common fruit sitting in many kitchens that can silently raise your risk of stroke almost overnight. And I'm not exaggerating. Research shows this fruit can actually promote blood clot formation, the very trigger behind most strokes. Now, before you panic, let me reassure you. My goal here is not to scare you. It's to give you knowledge in plain, simple words so you can make safer choices for your health. Because what you don't know can hurt you, and what you do know can save your life. Think about it for a moment. You eat something sweet and refreshing before bed, and the next morning you wake up dizzy, weak, or unable to move one side of your body. That's how sudden a stroke can strike. And in seniors, the risks are even higher. Why? Because as we age, our arteries become less flexible, our blood thickens more easily, and even small triggers can push the body toward clotting. And this fruit, surprisingly, happens to be one of those triggers. I'll be explaining what this fruit is in just a moment, but before we get there, I want to make sure you understand exactly why it can be dangerous and how strokes truly happen. That way, by the time I reveal the fruit, you'll clearly see the connection, and you'll never look at it the same way again. So here's what we're going to do in this video. First, I'll give you a simple breakdown of stroke and clotting, not textbook medical jargon, just senior-friendly explanations. Then, I'll reveal the fruit that has been shocking even doctors with its effects. Finally, I'll guide you through safer alternatives and prevention steps, so you leave not only informed, but also empowered. But for now, I want you to lock in your attention. Because this isn't one of those maybe helpful, maybe not health tips. This is the kind of advice that can change how you eat tonight and possibly protect your brain and heart tomorrow morning. Let me ask you a question. If you knew that just one piece of fruit could make your blood clot more easily, would you still eat it before bedtime? Most seniors I talk to answer no. Of course not. And that's why this message is so urgent. Strokes are the second leading cause of death worldwide. In the United States alone, nearly 800,000 people suffer a stroke every single year. And the majority of those strokes are triggered by blood clots that block vital blood flow to the brain. Now imagine unknowingly adding fuel to that fire with your diet. That's exactly what happens when seniors regularly consume this fruit in large amounts, especially at night when the body is less active. Here's the good news. Once you know about it, you can control it. And with just a few smart swaps in your diet, you can still enjoy sweet flavors without putting your health on the line. So stay with me. Because in the next section, I'm going to break down in plain English what really happens inside the body during a stroke. And trust me, once you see the process clearly, you'll immediately understand why this fruit is far more dangerous than it appears. Your health is worth this knowledge. And today, I'm here to make sure you have it. Before we talk about the fruit itself, it's very important to understand what a stroke really is. Because once you see the mechanics of how it happens inside the body, you'll instantly understand why certain foods, even something as innocent as fruit, can make a huge difference. So what is a stroke? A stroke happens when blood flow to part of the brain is suddenly cut off. Your brain cells, like all cells in your body, need a constant supply of oxygen-rich blood. When that flow is blocked, even for just a few minutes, brain tissue begins to die. And unlike other organs, the brain cannot repair dead tissue. That's why strokes are so dangerous. There are two main types of strokes, ischemic and hemorrhagic. An ischemic stroke, which is by far the most common, is caused by a blood clot that blocks an artery in the brain. A hemorrhagic stroke, less common but often more deadly, happens when a weakened blood vessel bursts and bleeds into the brain. In both cases, brain cells are starved of oxygen, and the damage begins quickly. Now here's the part many seniors overlook. And most strokes, nearly 87%, are ischemic, meaning they start with a clot. And clots don't just appear out of nowhere. They build slowly over time due to sticky cholesterol deposits, high blood pressure damage, or even thickened blood from certain foods. That's why lifestyle plays such a big role. Think of your arteries like water pipes in your home. When they're clean and smooth inside, water flows easily. But when grease, rust, or blockages build up, the water pressure rises, and the pipe can clog or even burst. The same thing happens inside your body. For seniors, there are extra challenges. With age, arteries stiffen, circulation slows, and the body's natural clot dissolvers don't work as efficiently as they used to. That means even a small trigger, like eating a fruit high in clot-promoting compounds, can tilt the balance and lead to trouble. Another important factor is nighttime. Why? Because when you sleep, your heart rate and blood flow slow down. If you eat something that thickens the blood or spikes clotting right before bedtime, your body doesn't have the same circulation power to clear it away. That's why strokes are most common in the early morning hours. I want you to picture this. Inside your artery, blood is flowing smoothly. Then, a sticky clot begins to form, like mud sticking to the inner wall of a pipe. At first, it's small, but within hours, it can grow large enough to block blood flow completely. And if that blockage happens in the brain, the result is a stroke. This is why doctors emphasize prevention so strongly. Because once a clot has formed and blocked the brain, emergency treatment is limited, and time is the most critical factor. Every second counts. Here's something sobering. In the United States, someone has a stroke every 40 seconds, and every 3 minutes and 14 seconds, someone dies from a stroke. These numbers are not meant to scare you. They are meant to show how common and urgent this health issue is. But here's the hopeful side. Up to 80% of strokes can actually be prevented through diet, lifestyle, and awareness of risks. And yes, that includes knowing which fruits to eat freely and which to limit or avoid. So now you understand the foundation. Stroke equals loss of blood supply to the brain. Most strokes equals clots blocking an artery. Seniors equals higher risk due to stiff arteries and slower circulation. Nighttime eating equals extra risk factor. Keep these points in mind, because in the next section, I'll finally reveal the fruit that's been linked to clotting and stroke risk. And once you hear it, you may be just as shocked as I was when I first learned about it. Now we come to the part you've been waiting for. The fruit that research has linked to increased risk of clotting and stroke in seniors. And I must be very clear here. This is not about demonizing fruit or scaring you into avoiding healthy foods. It's about moderation and understanding how even natural foods can have side effects when eaten in excess, especially as we age. So what is this fruit? It's grapefruit. Yes, the same grapefruit many people enjoy for breakfast or as a healthy snack. On the surface, it looks innocent, bright, juicy, refreshing. But grapefruit has a hidden side that most seniors are never told about. Here's why. Grapefruit contains natural chemical compounds called furanocoumarins. These compounds interfere with enzymes in the liver and intestines, particularly an enzyme called CYP3A4. This enzyme is responsible for breaking down many common medications. When grapefruit blocks this enzyme, medications can stay in the bloodstream much longer and in much higher amounts than intended. Now you may ask, Doctor, what does this have to do with stroke risk? Excellent question. Many seniors take medicines for blood pressure, cholesterol, or heart rhythm. When grapefruit interferes with these medicines, it can cause dangerous spikes in drug levels. For example, some blood pressure drugs can suddenly drop pressure too low, while certain cholesterol drugs can thicken the blood or damage muscles. This imbalance increases the risk of clotting and stroke. But even without medications, grapefruit itself has a clotting effect for some people. Studies suggest that compounds in grapefruit may increase platelet stickiness. That's the tendency of blood cells to clump together. The stickier the platelets, the more likely a clot will form. And in seniors with stiff arteries, that risk multiplies. Here's the shocking part. You don't have to eat a giant portion. Even one glass of grapefruit juice can be enough to alter drug metabolism or tilt blood chemistry toward clotting. That's why hospitals often place warning signs in their cafeterias. Do not drink grapefruit juice if you are on medication. Another hidden danger is timing. Many seniors like to enjoy grapefruit or grapefruit juice at night, thinking it's a light snack. But remember what we discussed earlier. Nighttime circulation is slower. Combine slower blood flow with grapefruit's clot-promoting effects, and the chance of an early morning stroke rises. To make matters more concerning, grapefruit interacts with more than 85 different medications, many of which are commonly prescribed to seniors. This includes statins, cholesterol drugs, calcium channel blockers, blood pressure drugs, anti-arrhythmia medicines, heart rhythm drugs, blood thinners, and clot regulators. The result? An unpredictable cocktail effect inside the body. Now, I want to be clear. Grapefruit is not poisonous. It is still a fruit with vitamins, fiber, and antioxidants. The problem is specific to seniors, and especially those on medications. Your younger neighbor might enjoy grapefruit daily with no problems. But for you, with a heart condition, high blood pressure, or clotting risks, grapefruit can be a silent trigger. That's why I'm begging you to be cautious. Don't think it's just fruit, it must be safe. Nature is powerful, and grapefruit proves it. So let me recap in simple points. Grapefruit blocks the liver enzyme CYP3A4. This raises drug levels in the blood. It can increase platelet stickiness and clot risk. Stroke risk is higher if eaten at night. Seniors on medication are the most vulnerable. Now I know some of you may be thinking, "Doctor, I've eaten grapefruit for years and I'm fine." And that may be true, but stroke risk is like a ticking clock. You may not notice the damage until one day it strikes suddenly. So my advice is, check with your doctor before eating grapefruit regularly. And if you're on any long-term medication, consider safer alternatives. In the next section, I'll explain in detail how grapefruit affects the body step by step, so you'll see the exact chain reaction inside your arteries and blood when you eat it. Now that you know grapefruit is the fruit in question, let's walk step by step through what actually happens inside your body when you eat it. Understanding this process makes everything crystal clear. The moment you take a bite of grapefruit, the digestive process begins in your mouth. Your saliva starts breaking down the sugars, while the bitter compounds move toward your stomach. Once the grapefruit reaches your intestines, the real effect begins. Inside the lining of your intestines, there is a crucial enzyme called CYP3A4. Its job is to process many medications and help regulate how much gets absorbed into your bloodstream. Think of this enzyme as a filter. It keeps drug levels balanced, not too high and not too low. But grapefruit blocks this enzyme almost like flipping an off switch. So instead of medications being filtered, more of them enter the bloodstream all at once. This sudden surge can overload the body, especially the heart, blood vessels, and brain. For seniors taking blood pressure medications, this may cause dramatic drops in blood pressure. That can mean dizziness, fainting, or even falls, which are already a major risk for seniors. For those on cholesterol-lowering drugs, grapefruit can make the blood thicker and harder to pump, which raises clotting risk. And when the blood clots, the brain is the organ most at risk. But that's not all. Grapefruit also affects the liver. The liver is like your body's chemical factory, processing both nutrients and medicines. When grapefruit compounds interfere here, the liver cannot clear excess drugs efficiently. This leaves the bloodstream flooded with higher doses than intended. Now let's focus on blood itself. Research shows grapefruit compounds may make platelets, those tiny cell fragments that stop bleeding, stickier. In small amounts, platelet stickiness is good. It helps seal cuts, but in large amounts, sticky platelets start forming clots inside arteries. And once a clot forms in the brain's artery, the result is a stroke. Here's something important. Grapefruit doesn't just act for a few hours. Its enzyme-blocking effect can last up to 24 hours after eating. That means even if you eat grapefruit in the morning, your medications at night could still be affected. And the more often you eat it, the stronger this effect becomes. Picture this in real life. A senior eats half a grapefruit at breakfast. They take their blood pressure pill in the evening. Because the enzyme filter is still blocked, the pill enters the blood at double or triple strength. During the night, circulation slows, blood pressure drops too low, and clots become more likely. By morning, the stage is set for a stroke. This is why doctors and pharmacists place grapefruit on the caution list. It's not that the fruit itself is toxic. It's that it changes how the body handles other substances. Even if you're not on medication, grapefruit can still have effects. Its compounds interact with calcium channels in blood vessels, sometimes tightening or relaxing them unpredictably. This can create spikes or dips in circulation, stressing the heart. And for seniors whose arteries are already stiff and whose blood may be thicker, that added stress is enough to tip the balance toward clotting. So to sum it up, grapefruit blocks enzyme filters in the intestines. Medications build up to dangerous levels, platelets get stickier, clots form more easily. The liver struggles to clear excess. Circulation becomes unpredictable, especially at night. This is why grapefruit is not simply another fruit. It's a powerful natural substance that interacts directly with your body chemistry. The good news is, you don't have to give up fruit altogether. In the next section, I'll walk you through the warning signs of blood clots and stroke, so you know exactly what to watch for. Now that you understand why grapefruit can raise the risk of clotting and stroke, the next step is recognizing the warning signs. Because when it comes to stroke, every second matters. Doctors often use the acronym FAST to teach stroke symptoms. F stands for face drooping. One side of the face may suddenly look uneven or sag. A stands for arm weakness. If you raise both arms, one may drift downward. S stands for speech difficulty. Words may sound slurred, jumbled, or hard to form. T stands for time to call emergency services. Acting quickly can save the brain from permanent damage. But stroke symptoms can appear in other subtle ways, especially in seniors. Let's go through them one by one. First, sudden vision changes. If one eye suddenly becomes blurry, dark, or completely loses vision, that can be a mini-stroke, also known as a TIA. Second, dizziness or sudden loss of balance. If you feel like the room is spinning or your body suddenly tilts to one side, this can be more than simple aging. It could mean blood isn't reaching the brain properly. Third, severe sudden headache. Unlike a normal headache, this one feels like the worst headache of your life, and it comes on instantly. For some people, it feels like a bolt of lightning in the head. Fourth, numbness or tingling. If one side of your body suddenly feels numb, heavy, or asleep, even if it passes after a few minutes, that is a red flag. Fifth, confusion or memory problems. If you suddenly forget where you are, what you're doing, or struggle to understand words, that can be an early stroke symptom. Now, let's talk about clot symptoms in other parts of the body. Clots don't only cause strokes. They can form in the legs, lungs, or heart as well. In the legs, this condition is called deep vein thrombosis, or DVT. It usually starts with swelling, pain, warmth, or redness in one leg. In the lungs, a clot is called a pulmonary embolism. Warning signs include sudden shortness of breath, chest pain that worsens when breathing in or coughing up blood. In the heart, clots can trigger a heart attack. The classic signs are chest pressure, pain radiating into the arm or jaw, sweating, and nausea. The important point here is, no matter where the clot forms, it's an emergency. Delaying treatment can mean the difference between full recovery and permanent damage. Many seniors mistake these symptoms for just getting older, but aging alone does not cause sudden slurred speech, drooping, or loss of vision. Those are stroke signs until proven otherwise. Here's a helpful tip. If you notice a symptom, don't wait to see if it gets better. Even if it disappears after a few minutes, that may have been a TIA, a mini-stroke that warns of a bigger one coming soon. Calling for help right away gives doctors a chance to act quickly. Clot-busting treatments are most effective in the first 3 to 4.5 hours. After that, the window of opportunity begins to close. So the key takeaway is this: know the signs. Act immediately. Never ignore sudden changes in your body. In the next part, we'll discuss who is at the highest risk and what lifestyle steps you can take to stay safe. Now that you clearly understand the risks of certain fruits, especially grapefruit, let's move into the solutions. Because health is not about fear. It's about making better choices. The good news is that seniors have many safe, delicious, and nutritious alternatives that support circulation, reduce clotting risk, and protect the heart. First, let's talk about safer fruit options. Apples, pears, peaches, berries, and bananas do not interfere with most common medications. They provide vitamins, minerals, and fiber without raising clot risks. For example, apples are high in quercetin, an antioxidant that helps fight inflammation. Blueberries and strawberries are packed with anthocyanins, which improve blood vessel health. Bananas give potassium, which supports healthy blood pressure. These fruits are senior-friendly, affordable, and widely available. Second, hydration is crucial. Many seniors don't drink enough water. Dehydration thickens the blood, which makes clots more likely. Aim for 6 to 8 glasses of water daily unless a doctor recommends fluid restriction. Third, moderation is key. Even safe fruits can cause sugar spikes if eaten in excess. A balanced plate with half vegetables, 1/4 lean protein, and 1/4 healthy carbs works well. Fruits should be enjoyed as part of the healthy carbs portion. Now, let's focus on foods that naturally thin the blood in safe ways. Leafy greens like spinach and kale support circulation, though if you're on blood thinners, your doctor may want you to keep intake steady. Garlic, onions, and ginger have natural anti-clotting properties. Fatty fish like salmon, mackerel, and sardines provide omega-3s, which protect arteries. Nuts and seeds, like almonds, walnuts, and flax seeds, add healthy fats and magnesium. Olive oil is another senior-friendly choice for heart health. Also, don't forget about fiber. High-fiber foods keep cholesterol low, which reduces plaque buildup in arteries. Oats, beans, lentils, and whole grains are excellent daily staples. Now, let's move into healthy lifestyle adjustments. A simple 20-minute walk after meals helps keep blood sugar and circulation stable. Even light chair exercises improve mobility and reduce clot risk. Deep breathing exercises support oxygen flow and relaxation. Sleep is another overlooked factor. Poor sleep raises blood pressure and damages blood vessels. Seniors should aim for 7 to 8 hours of quality rest. And finally, stress management. Constant stress raises cortisol, which thickens blood and increases clot risk. Simple activities like gardening, reading, listening to calming music, or even light stretching can bring stress levels down. The big takeaway is this: replace risky fruits with safe ones. Stay hydrated, eat a balanced, fiber-rich diet, move daily, even if gently. Protect your sleep and manage stress. This lifestyle doesn't just reduce stroke risk. It improves overall energy, memory, and independence for seniors. In the next part, we'll take these healthy habits and expand into a complete prevention and lifestyle guide designed specifically for seniors. At this stage, you now understand the risks, symptoms, and safer choices. But let's tie everything together into a simple, daily prevention plan for seniors. Stroke prevention is not just about avoiding one risky fruit. It's about creating a lifestyle that protects the heart, brain, and blood vessels. 1. Exercise for circulation. Movement is medicine. Even light activity, like walking, stretching, or gardening, keeps blood flowing smoothly. Aim for at least 30 minutes of gentle exercise most days of the week. If walking is difficult, try chair yoga or light resistance bands. 2. Control blood pressure and cholesterol. High blood pressure and high cholesterol are the two biggest stroke risk factors. Get your blood pressure checked regularly. Eat low-salt meals, limit fried foods, and choose heart-friendly fats like olive oil and fish. If your doctor prescribes medication, take it exactly as instructed. 3. Manage weight and blood sugar. Excess weight and diabetes both increase clot risk. Focus on smaller, balanced meals spread throughout the day. Replace white bread and sugar with whole grains and fresh fruits. Steady blood sugar protects your arteries. 4. Stop smoking and limit alcohol. Smoking damages blood vessels and makes blood sticky, raising clot risks. Alcohol, especially in excess, raises blood pressure and interacts with many medications. If you drink, limit it to 1 small glass a day or less. 5. Stay hydrated and well rested. Water keeps blood thin and flowing. Poor sleep raises stress hormones that thicken the blood. Seniors should drink 6 to 8 glasses of water daily and aim for 7 to 8 hours of restful sleep. 6. Stress management. Stress increases cortisol, which harms blood vessels. Relaxation techniques like deep breathing, light meditation, listening to calming music, or simply spending time with family can lower stress levels. 7. Regular medical checkups. Don't wait for problems to appear. Routine checkups help catch risks early. Blood tests, blood pressure checks, and heart screenings can prevent dangerous surprises. 8. Know the warning signs. Even with prevention, strokes can still happen. Remember FAST, face drooping, arm weakness, speech difficulty, time to call emergency services. Quick action saves lives. The key message here is balance. You don't need to be perfect. You just need consistency. Small steps each day add up to powerful protection. In the final part, we'll recap everything and leave you with empowering closing thoughts. We've reached the final part of our journey together. Let's step back and reflect on what we've learned. First, we uncovered a surprising truth. A simple fruit like grapefruit can quietly interfere with medications and increase the risk of blood clots, strokes, and heart issues in seniors. This is not about fear. It's about awareness. Second, we explored the science behind strokes, the warning signs, and how fast action can save lives. Remember the acronym FAST, face drooping, arm weakness, speech difficulty, time to call emergency services. Third, we highlighted the safer alternatives. Fruits like apples, berries, bananas, and pears are nourishing, safe, and supportive of overall heart health. We also reviewed diet, hydration, and lifestyle habits that protect circulation. Fourth, we created a prevention guide, moving daily, eating balanced meals, avoiding smoking, managing stress, and staying consistent with checkups. These small steps truly add up. Now here's the most important takeaway. You have the power. Every choice you make today shapes your health tomorrow. Seniors often feel like aging means losing control, but that's not true. You can stay strong, independent, and vibrant with a little awareness and daily effort. And here's my heartfelt request. Please share this knowledge. If you have friends, neighbors, or family members over 60, tell them about this video. Your words might save someone's life. Before we close, let me remind you, health is a lifelong journey. It doesn't require perfection. It requires persistence. Even if you start with just one small change, like swapping a risky fruit for a safer one or adding a daily walk, you are already on the path to better health. Finally, if you found this video helpful, please subscribe to the channel. We share important updates, tips, and senior-friendly guidance every week. By subscribing, you'll stay informed about the latest health insights. Click the notification bell so you never miss new content. And if you learned something today, give this video a like. It encourages us to keep making valuable content for you. Together, we can build a healthier senior community, one step at a time. Thank you for spending this time with me. Take care of yourself, stay alert, and I'll see you in the next video.